Welcome everybody, I'm Dr. Jacobin. I'm the Medical Director of Renew Vitality. We're going to talk about a commonly mystified topic, which is how to inject yourself. How to inject yourself. People are oftentimes afraid of the concept, afraid of actually doing it. There's no need to be. Once you see it, the whole thing will be demystified, I promise you. We're going to start with the mother of all injections, testosterone. How do we do this? First of all, basic things, obviously, wash your hands, prepare, and so on. We're going to talk about how to draw this. We're going to talk about how to actually inject it. You'll see packages usually will come with a series of needles, right? Or at least two needles. There's a drawing needle, which is typically larger, and then there is a smaller needle, which is fit for humans, right? When you see them most of the time, you can sort of tell which is which, even if you don't know any better, right? But regardless, we're gonna look. So typically we'll use something like a 22 gauge, which is a larger one, to just aspirate, and then we're gonna repeat it, remove the needle, and then we're gonna go forward that way, right? So let's get started. You're gonna pop the cap off, right? You wipe this with alcohol, always, despite the fact that you're using sterile needle. Make sure always that you're using sterile equipment. If something's been opened or if it's been lying around or you don't know where it's been, don't use it. Use another one, okay? You're gonna use the 22 gauge here to draw it, right? So remember, this has been wiped with alcohol, right? You cap it so it's nice and tight, remove it, pull out just a tiny little bit of air, and then you go right through the middle, invert it, right? And then slowly pull out. It's not a race, right? Remember, particularly with things such as testosterone, it's very viscous, oily substance, so don't expect it to just gush through. It does take a little bit. Standard dose, we're gonna assume in this case, right, like it is in a lot of cases, it's 1 milliliters, right, depending on how this is concentrated. So we're gonna see if we can pull up to the camera. You're gonna see this a little bit closer. I'm gonna show you to make sure that you're getting to 1 milliliter and not over and not less. It seems simple, and basically once you see it, you will see what I'm talking about. If you notice how this is going slowly, that's expected, right? So people a lot of times will worry that the needle's defective, the syringe is defective. No such thing. It's just, as I said, it's an oily molecule, so it does take a little bit because of its viscosity. So we're almost there. Now you're gonna notice the top, right? So notice the part of my syringe, notice the top of it. That's really what's gonna give you the dosage, right? So we're basically at 1 milliliter. I'm gonna turn it. You guys can see it for the camera. Here we are. Pull out, okay? So now we have our testosterone has been drawn. What do you do? Very carefully recap this, unscrew it, and now we're gonna use our injection needle. Injection needle is a lot smaller, a lot more human-friendly, if you will. So pull it back out. Now what are we gonna do? Make sure that you go to the tip, right? Make sure that you don't see any air bubbles at the tip so that you see medications flush with the tip so you don't waste it, but also that there's an air. Remember, needles these days have filters, right? So people are always concerned that there is like a half a bubble of air, they're gonna drop that. That is not the case. But regardless, do your best to make sure that you don't see it and you can see it clearly like for the camera, right? All right, so now what we're gonna do is we're going to pick up our glutes, okay? So we're gonna show you. So if you're looking, this is right side, left side, right? This is just an illustration so you could see fat tissue and the muscle. Remember, for testosterone, we're actually injecting in the muscle. So the idea is not to make this so superficial that it becomes lumpy and weird, but rather so it's absorbed directly into the muscle. The glutes are usually a fairly large muscle. That means that the absorption is a bit more reliable in terms of how long it'll take to dissipate, and so on and so forth. So we're gonna look at the right glute, and basically what you can do, you don't have to draw it, obviously, but you can mentally visualize this into 4 quadrants, okay? The safe zone is if you focus on the upper outer quadrant. So don't go down here, don't go down here, don't go down here. A couple of vital structures that run through it, particularly your sciatic nerve, which you don't want to be nicking with the needle, obviously. Here is basically just tissue and muscle, right? All right, so here we go. We have our injecting needle, right? And as we said before, this is the right buttock, right? So 4 quadrants. Upper outer quadrant is always your safe zone, right? So it's also very convenient because it's usually, if you're gonna do it yourself, the side that's easier to access, right? So the idea is to do this smooth, not quickly. Remember, the same way that it took a little bit for it to draw, we're now using an even smaller needle, right? So the idea is that it's gonna take a little bit to go in. It's not designed to just go in like a missile and just go in 30 seconds. It's not quite like that, right? So upper outer quadrant, again, remember your skin has been cleansed and you basically go in one smooth motion, okay? Once it's in, you ever so slightly pull back just to make sure you don't see any obvious blood. You shouldn't in the zone. And then you very, very slowly and smoothly apply it. Notice if you can see it on the close-up, it's going slowly because remember, it is an oily substance and the goal is not to win a race, right? The goal is simply to do this safely. Try not to move your needle when you're inside of it, right? So once the dip is where it is, leave it where it is until you're done, okay? Once you pull out, you're gonna have a little bit of gauze. You're gonna have a 2x2 or 4x4, whatever the case may be, and then you're gonna pull out. And the same way that you went in with the needle fairly swiftly, you're gonna do the same thing when you come out. So obviously it's somatic, it's not gonna bleed, but it's the idea. You pull back out, you hold some pressure for 15, 20 seconds, just hold it. Once you clean it, you won't see any more blood. Put a little Band-Aid if you're so inclined, and then you're done. A lot simpler than it seems.